Stomach pain is something that almost everyone has felt at one point or another. It doesn't matter if you are young or old, healthy or sick, sooner or later, you'll experience it. Sometimes the pain is very mild, just a small cramp or tightness that passes in a few minutes. Other times it's so strong that it makes you double over, cancel plans, or even rush to the hospital. Because stomach pain is so common and can mean many different things, it's important to understand the different causes and how to respond. That's exactly what we'll be talking about today. The common causes of stomach pain, the more serious ones you should never ignore, and some simple ways to keep your stomach healthy. First, let's clear up one thing. When people say stomach pain, they usually mean any type of pain in the belly area, which doctors call the abdomen. But your stomach is only one organ in that area. The abdomen also contains your small intestine, large intestine, gallbladder, liver, pancreas, appendix, kidneys, and more. Pain in this region can come from any of those organs. That's why stomach pain can be confusing. It's not always your stomach that's the problem. Let's start with the everyday, harmless causes, because they're by far the most common. The first one is indigestion. Indigestion happens when your stomach has trouble processing the food you just ate. Maybe you ate too quickly, maybe you ate too much, or maybe the food was too greasy or spicy. The result is discomfort, a burning sensation, bloating, or just feeling overly full. Indigestion is uncomfortable, but usually goes away on its own. If you've ever finished a big late-night meal and felt heavy or restless afterwards, that's indigestion. Gas and bloating are another huge cause of stomach pain. Gas builds up in your digestive system when your body breaks down certain foods, or when you swallow air while eating, drinking, or even chewing gum. When that gas gets trapped, it can stretch your intestines and cause sharp cramps. The pain might even move around. Sometimes it's at the top, sometimes at the bottom, sometimes on the sides. Many people find relief when they pass gas or use the bathroom. Foods like beans, cabbage, onions, and carbonated drinks are famous for causing gas. Constipation is another simple but very common reason for stomach pain. If your bowels aren't moving regularly, stool builds up and puts pressure on your intestines. This stretching causes pain that often feels like cramping in the lower abdomen. It can also make you feel bloated and sluggish. Low-fiber diets, not drinking enough water, and sitting for long periods all contribute to constipation. Adding more fruits, vegetables, whole grains, and daily movement can make a big difference here. Now let's talk about acid reflux, sometimes called heartburn. Acid reflux happens when the acid in your stomach flows back up into your food pipe, also known as the esophagus. That acid isn't supposed to be there, so it causes a burning pain in the chest or upper stomach. Some people also taste sour liquid in their mouth. Acid reflux is very common, and it can be triggered by spicy foods, fatty meals, chocolate, caffeine, alcohol, or even lying down too soon after eating. If it happens frequently, it may be a sign of a condition called gastroesophageal reflux disease, or GERD. Something that surprises a lot of people is that stress can also cause stomach pain. Your gut and your brain are connected in a very close way. Scientists call this connection the gut-brain axis. When you're stressed or anxious, your body produces hormones that affect the digestive system. That's why nervousness before an exam or a big event can give you butterflies in your stomach. But with stronger or long-lasting stress, you can get real cramps, diarrhea, or constipation. It shows how powerfully the mind and body are linked. Food intolerances and allergies are another group of causes. Lactose intolerance is one of the most common. People who have it lack enough of the enzyme needed to digest lactose, the sugar in milk and dairy products. As a result, eating ice cream, cheese, or milk leads to bloating, cramps, and sometimes diarrhea. Another example is gluten sensitivity, or celiac disease. For those people, eating foods with wheat, barley, or rye can trigger serious digestive pain. Caffeine, artificial sweeteners, and very fatty foods can also upset sensitive stomachs. If you suspect food intolerance, keeping a food diary can help identify patterns. Now, let's move into infections. Food poisoning is one of the most unpleasant and unfortunately common stomach problems. It happens when food or drink contains harmful bacteria like Salmonella E. coli, or Listeria. Symptoms usually hit fast, within a few hours or a day after eating. They include sudden stomach cramps, nausea, diarrhea, and vomiting. Food poisoning is miserable, but usually improves within a couple of days. The most important thing is to stay hydrated. Appendicitis is a big one. The appendix is a small organ attached to the large intestine on the lower right side of your abdomen. When it becomes inflamed, the pain often starts near the belly button and then shifts to the lower right side. The pain gets sharper with time, and moving, coughing, or touching the area makes it worse. Appendicitis usually comes with fever, nausea, and loss of appetite. If left untreated, the appendix can burst, causing a dangerous infection. That's why appendicitis is always a medical emergency. Gallstones are another serious cause. The gallbladder is a small organ under your liver that stores bile, a fluid that helps digest fat. Sometimes stones form in the gallbladder and block the bile ducts. This leads to intense pain under the right ribs, especially after eating fatty meals. The pain may also spread to the back or right shoulder. Gallstone attacks can last minutes or hours, and they sometimes come with nausea and vomiting. Ulcers are also important to mention. An ulcer is an open sore on the lining of the stomach, or the upper part of the small intestine. Ulcers cause burning or gnawing pain in the upper stomach, often when the stomach is empty. Some people find the pain improves after eating, while for others, it gets worse. Ulcers can be caused by a bacteria called Helicobacter pylori, or by overusing painkillers like ibuprofen or aspirin. If untreated, ulcers can bleed and cause serious complications. Kidney stones can also create stomach or abdominal pain, even though they're not part of the digestive system. Kidney stones are hard crystals that form in the kidneys and block the urinary tract. They cause severe pain that often starts in the back or side and then moves to the lower abdomen and groin. The pain comes in waves and can be so intense that people can't sit still. Blood in the urine and frequent urges to pee are other signs. Other serious causes of abdominal pain include pancreatitis, which is inflammation of the pancreas, liver problems like hepatitis, hernias, and in rare cases, tumors. These are less common, but worth keeping in mind, especially if pain is long-lasting or unexplained. So how do you know when stomach pain is serious and when it's not? The answer depends on the details. Mild pain that comes and goes, especially after certain foods or stress, is usually nothing to worry about. But if the pain is sudden, severe, or unlike anything you felt before, that's a warning sign. Other red flags include fever, vomiting, fainting, blood in your stool or vomit, or yellowing of the skin and eyes, which is called jaundice. If your pain lasts more than a few days without getting better, or keeps coming back, you should see a doctor. Now let's talk about prevention. Things you can do every day to keep your stomach healthy and avoid pain. Eating balanced meals is a big one. Fill your plate with a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid overloading on fried and heavily processed foods. Drinking enough water throughout the day is just as important. Hydration keeps your digestive system moving and helps prevent constipation. Managing stress is another key factor. Stress not only upsets your stomach, but also affects your entire body. Regular exercise, meditation, journaling, or even short breaks during the day can lower stress and make your stomach happier. Pay attention to your body's signals. If a certain food always makes you uncomfortable, don't ignore it. Limiting or avoiding that food could save you a lot of pain. Keeping a simple food diary for a couple of weeks can make patterns very clear. Lastly, don't underestimate the value of movement. Regular physical activity, even something as simple as walking, helps digestion, prevents constipation, and reduces bloating. Aim for at least 30 minutes of activity most days of the week. To sum up everything we've covered, stomach pain is one of the most common health complaints. Most of the time, it's caused by everyday issues like indigestion, gas, constipation, or mild infections. Stress, food intolerances, and acid reflux are also frequent triggers. On the other hand, some causes like appendicitis, gallstones, ulcers, and kidney stones are much more serious and require medical attention. The key is to listen to your body, recognize warning signs, and take action when something feels wrong. With a healthy lifestyle, balanced diet, hydration, stress management, and regular exercise, you can avoid many stomach problems. But if you ever feel pain that's severe, unusual, or long-lasting, don't wait it out. Seek medical help. Your stomach is an important messenger, and paying attention to its signals can protect your overall health. Thank you for joining me in this deep dive into stomach pain and its causes. I hope you now have a clearer picture of what might be happening the next time your stomach hurts.